VAP-Sambhasha of Vishwa Ayurveda Parishad. Today we have with us a renowned personality of IMS BHU, Professor Rajesh Meena. Professor Rajesh Meena is a professor in the Department of Anesthesiology and Critical Care. Sir is also in charge of as the Deputy Medical Superintendent of Trauma Center here. He is in charge of the Skills Center and the Nodal Officer of NELS. He is a fellow in Trauma and Mass Casualty System, RAM Medical Complex, Haifa, Israel. He is a fellow of International College of Anesthesiology, master trainer of COVID-19 management for DGME UP State, and many more. He is an instructor for the BLS, ACLS, and many more programs. We know him because he's every year it is he who takes the responsibility of training all the students in all the faculties of the Institute of Medical Sciences at Banaras Hindu University. He trains not only students of medical sciences but other students of the allied sciences as well, such as students of Ayurveda, students of nursing, students of dental, UG, PG, and all the students. It is under his in chargeship that we all go into the skill center and learn the emergency techniques like the basic life support systems, including the CPR procedure or the procedure of gastric lavage. Sir is a well-known physician as well, and he takes care of the patients in charge of ICU and always ready to help us in all our needs. And today he has wholeheartedly agreed to be with us and deliver this guest lecture. He will be practically demonstrating on the procedures that are essential, which have been latestly included in the curriculum of the BAMS students. So on behalf of the coordinating team of VAP-Sambhasha of Vishwa Ayurveda Parishad, I extend a wholehearted welcome to you, sir.
Thank you so much.
May I now request Professor Rajesh Kumar, sir, to please continue.
Thank you, ma'am, for inviting me for this by everyone, even a bystander, even layman should know the BLS. So for Ayurveda physicians, it should be mandatory to learn BLS. So we'll discuss BLS, then we'll discuss the gastric lavage. So what is BLS basically? There is two parts. One is a basic life support and one is advanced cardiac life support. So what is the difference between these two, like basic and advanced? So for basic life support, you don't need any advanced gadgets or equipments to support a life. And in advanced cardiac life support, you need drugs, you need advanced equipment to support the patients. BLS basically is performing out of hospital cardiac arrest situations as well as in hospital cardiac arrest situations. So to move on ACLS, you have to be perform BLS first, then you can jump on the ACLS. So BLS is an integral part of each and every patient management. You must know the BLS at least. ACLS is a different thing. If you know, it is better. But BLS is mandatory and it should be learned by each and every person. So what BLS consists? Next. So our objective of today's lecture will be, we'll discuss out of hospital cardiac arrest situations, in hospital cardiac arrest, and compression only life supports, and what are the differences between the adult, children, and infants. If you are doing CPR to children and infants, what is the basic differences between these two? So what is the out of hospital cardiac arrest situations? So first, you should know what situations you need to recognize before you are assessing the response. Like, see, out of hospital cardiac arrest situations can be, you can meet in any scenarios. अगर आप कहीं भी जा रहे हैं, कोई रोड साइड आपको विक्टिम मिलता है, तो आप उसको भी आउट ऑफ हॉस्पिटल कार्डियक अरेस्ट बोलेंगे. या आप कहीं जा रहे हैं, कोई ड्राउनिंग का विक्टिम आपको मिल गया और उसको कार्डियक अरेस्ट है, दैट इज आउट ऑफ हॉस्पिटल कार्डियक अरेस्ट. सो व्हाट इज द डिफरेंस बिटवीन out of hospital cardiac arrest and in hospital cardiac arrest? So in out of hospital cardiac arrest, you just need to recognize the urgency of chest compressions. Okay. So why we need to know BLS? Apart from these two data, you can read BLS is a mandatory thing that you must know for a life. See, why we are here. See, suppose you save a single life in your 60 in your lifetime. So अगर एक भी आप life save कर लेते हैं by doing chest compressions, then it would be a great help of the society as well as a mankind. So mortality, you can see the data that the sudden cardiac arrest जो incidences हैं, these are more common in our Indian patients or Indian scenarios in comparison to the US, or you can say the developed countries. So the most of the cardiac arrest happens because more than 60% of the cardiac deaths, and these deaths are mostly because of myocardial infarctions, where your heart stops pumping. So in that case, you need to maintain the blood circulation of all the vital organs. See, because the main action of the heart is the pumping of the blood, but your heart went into the arrest, shock में चला गया. Now, what are the conditions behind, or what are the causes behind the cardiac arrest? You need to further evaluate. The another team will be managing these things, but immediately you have to do the chest compressions, the passive chest compressions that will manage the blood flow of the vital organs like brain, kidney, liver. Because if the blood circulation will hamper in these vital organs will be having a ischemic injuries. And because of this ischemic injuries, your victim, you can say, or your patient may land up into the like acute kidney injuries, acute hepatic injuries, and brain injuries. And because of these injuries, your patient land up into the severe coma, or you can say the brain death. So if patient or victim even survives after happening the brain dead, then it will be a no use. So it will be a burden to the society as well as to the nation. So we need to manage these are vital organs. So how can we manage? By just simply giving chest compressions. So how chest compression will work? You can see in this mannequin that your heart is lying inside a sternal cavity. See, आगे है आपका sternum, पीछे है आपके diaphragm, और इन दोनों के बीच में आपको जो क्लोज कैविटी है उसमें आपको हार्ट को कंप्रेस करना है, so that the adequate blood flow, that is the oxygenated blood that is lying in your veins, could be passively given to the brain. So by passively pumping your heart at a rate of 100 to 120 per minute will improve the blood flow to the vital organs. So 70% of out of hospital occurs at percent of them die. See, that's why we need to train each and every person regarding the BLS, because when the bystander or a family caregiver will give chest compressions to the victim, that victim will be further transferred to the higher centers, and then it will be effectively managed. But if the compressions will not be given in meantime, then it will become a brain dead. So that's why where the BLS is having a such importance, that you need to know each and every. See, suppose I got a cardiac arrest, so who will give me chest compressions immediately? My family members. Okay, so if they don't know how to give chest compressions, then what happens? Ultimately, the oxygenated blood will not go into the brain, and the brain will be dead. So my take home message from this BLS is that you must know how to give chest compressions to a victim, and you must circulate, or you must teach your family members as well as your fellow colleagues regarding the importance of chest compressions, that nobody can hesitate doing chest compressions कि मुझे तो आता नहीं, मैं कैसे chest compressions दूं. It is a very basic and easy things. Just by knowing the accurate skill, you can deliver the task. So every minute's delay in the resuscitation is decreasing your survival by 7 to 10%. So suppose अगर एम्बुलेंस आने में 10 मिनट्स की भी डिले हुआ, या हेल्थ केयर प्रोवाइडर या कंप्रेशन स्टार्ट करने में 10 मिनट्स का डिले हुआ, दैट मीन्स द मोर्टेलिटी इज ऑलमोस्ट 100%. एंड योर 3 minutes delay in the chest compressions will become the your victim will be brain dead. So unfortunately, because of our healthcare systems, our poor ambulance systems, and because of poor, you can say, एक क्रॉसिंग आपको जो है पार करने में भी 10 मिनट का टाइम लग जाता है, तो सोचिए कि आपके पास एम्बुलेंस आने के लिए कितना टाइम लगेगा. अगर आप इमीडिएटली कॉल भी कर देते हेल्प के लिए, तो यू कैन इमेजिन कि हमारे जो अपने सिनेरियोज में कितना टाइम लगेगा. सो आवर बाईस्टैंडर और फैमिली मेंबर, दे मस्ट नो द हाई क्वालिटी चेस्ट कंप्रेशन, एटलीस्ट द help arrives. So however, if CPR is performed immediately by someone nearby, the chance of survival victims can be increased. So this is all about the importance of BLS. So now, in which category of victims, or in, we can say, see, there is two terms. One is a victim and one is a patient. So when somebody is, you find lying unconsciously or having any road traffic accidents, that is called victim. And then when the victim reaches to the hospital, it becomes patient, because it is having a different set of pathologies. Okay, so the when to start BLS? See, you see a 60-year-old man lying on the roadside, so that means your victim, or you can say the man is unconscious. So unconscious or unresponsive. So जो भी आपको victim unconscious or unresponsive मिले, that means they need your help in terms of BLS. The person who suddenly stops breathing, अचानक से सांस लेना बंद कर दे, so that means that patient will require BLS. Means it will require the rescue breaths. तो rescue breaths आप कैसे देंगे? By doing a bag and mask ventilation, you can give a rescue breaths. And when your heart stops beating suddenly, means your patient or your victim is went to the cardiac arrest. तो आप कैसे आइडेंटिफाई करेंगे कि cardiac arrest हो गया है? Just checking the pulse. If pulse is there, that means your heart is beating. If pulse is not there, that means your heart stops. Means your victim needs chest compressions. Okay, so these are the scenarios where you need to start BLS. It should be done while waiting for the ambulance. आपको कब तक करना है BLS? जब तक कि advanced help या healthcare providers, those who are equipped and trained in emergency situations, they came to the victim. Till that, you have to give the chest compressions. So what are the causes behind the sudden cardiac arrest? It can be anything, like hypovolemic shock, like dehydration, electric shock, drowning, burn, overdose of anything like intoxications. So many things can cardiac. Severe hypoxia, means your patient or your victim is having in respiratory distress. That hypoxia ultimately lead to the cardiac arrest. So this is, you can see in the slide, this is a chain. So this is a chain of out of hospital cardiac arrest situations. So these are all interlinked. If you miss any of these steps, the chances of survival will be less. So these are the series of actions. So suppose you find a victim that is unconscious. So suppose this is your victim. So you can see this early recognition and activation. So how will you recognize? So for recognition, first you have to see the responsiveness. So how will you check the responsiveness of any victim? Check responsiveness means you have to give two stimulation. One is verbal and another is a tactile stimulation, because your victim might be a deaf. ठीक है, तो आपको tactile stimulation देना है. Tactile कहाँ पे देंगे आप? Shoulders पे. So you have to tap the shoulders like this. So your stimulation should be adequately firm enough to give a pressure on the shoulders. ठीक है, तो आपने उसको tactile stimulation दिया shoulder पे, उसके बाद verbal stimulation दिया कि आप ठीक है कि नहीं, और in the language that he can understand. Like आप local language use करिए, are you okay, आप ठीक है कि नहीं, और आप साउथ इंडिया में है तो आप वहां की लोकल लैंग्वेज यूज करिए. ठीक है, तो आपने टेक्टाइल स्टिमुलेशन दिया, उसके बाद से पूछा आप ठीक हैं. अगर आपका विक्टिम रिस्पॉन्स करता है, दैट मीन्स हाँ मैं ठीक हूं, या हाथ या पैर हिलाता है, दैट मीन्स योर विक्टिम इज रिस्पॉन्सिव. बट if he or she is not responding to your tactile and verbal stimulation, that means he or she is not responding, means unresponsive. Now what is the next step? You have to activate the emergency response system. क्यों activate emergency response system आपको वो करना है? Because your victim might need a help of advanced gadgets or advanced equipment that are the this is the ambu bag and this is AED. क्योंकि आपको कोई भी कार्डियक अरेस्ट सिचुएशंस जब डील करनी होगी तो आपको आपके अभी आप जब नेक्स्ट देखेंगे कि उसमें डिफिब्रिलेशन, बिकॉज योर पेशेंट इज अनकॉन्शियस, ही माइट नीड अर्ली डिफिब्रिलेशन, रेस्क्यू ब्रेथ्स इन टर्म्स ऑफ दिस बैग एंड मास्क वेंटिलेशन. सो ये सब जरूरत पड़ेगी, तो इसलिए आपको हेल्प बुलानी है. सो आपको हेल्प कहाँ से बुलानी है? अगर आप हॉस्पिटल प्रीमिसेस में है या आसपास के किसी हॉस्पिटल का नंबर जानते हैं तो वहां, otherwise you can dial a 108 or 102. This is a universal number. By dialing this you can ask the help, and what you have to tell them, that such and such person is unresponsive in that area, and I know the BLS, means I can do chest compressions only, CPR, and please send an help. आप वहां पे हेल्प भेज दीजिए, और हेल्प में एक एम्बू बैग और एडी जरूर भेज दीजिएगा. और आपको फोन तब तक कट नहीं करना जब तक आप वहां से क्लोज लूप कम्युनिकेशन ना हो जाए, मीन्स वहां से आपको कोई रिस्पॉन्स ना मिल जाए. अब आपने रिकॉग्नाइज कर लिया दैट योर विक्टिम इज अनरिस्पॉन्सिव, देन यू हैव टू एक्टिवेट द इमरजेंसी रिस्पॉन्स सिस्टम. आपने एक्टिवेट कर लिया, उसके बाद आपको क्या देखना है? Then the next step is you have to see that my victim is breathing or not. So simultaneously you have to see the breathing as well as pulse. So कहाँ आप pulse check करेंगे? You have to check the pulse at a carotid. So carotid artery आपको check करनी है. So carotid कैसे check करते हैं? You can feel, आप अपना भी feel कर सकते हैं. Like आप ट्रैकिया फील करिए मिड लाइन. सो आपने ट्रैकिया फील किया, ट्रैकिया फील करने के बाद जस्ट लैटरली अपनी फिंगर्स को मूव करिए, जो फर्स्ट ग्रूव है वहां पे आप देखेंगे लाइक दिस. सो दिस इज योर ट्रैकिया, यू कैन सी दिस, एंड यू जस्ट मूव इट लैटरली, एंड दिस इज योर फर्स्ट ग्रूव. दिस इज बिटवीन द sternocleidomastoid. So this is where you can feel the bounding pulse, that is a carotid pulse. So if you are not able to feel that pulse, that means your patient is in a cardiac arrest situation. And simultaneously, while you are checking the pulse, you have to see the breathing also. So for breathing, you just need to जस्ट बेंड इट डाउन और पैरेलल में आना है आपको, जो पेशेंट के बॉडी के पैरेलल, एंड यू सी द रिस्पॉन्स, मीन्स जो चेस्ट वॉल का जो मूवमेंट है दैट इज अप एंड डाउन हो रहा है कि नहीं. दैट मीन्स अब आपने देख लिया कि देर इज नो ब्रीदिंग एंड नो पल्स. सपोज ब्रीदिंग इज देयर but pulse is not there, and suppose the pulse is there but breathing is not there. So if breathing is not adequate, you just give the bag and mask ventilation, and then see the pulse and breathing both are not present. So in that scenario you have to start the chest compression. That is a second link, that is a early high quality CPR. So there are two words. Early means you don't have to waste your time for the assessing the carotid pulse not more than 10 seconds. आपको breathing और pulse दोनों ही within 10 seconds assess करने हैं, because every second matters here. जितना आप delay करेंगे आपके victim के survival के chance उतने ही कम हो जाएंगे. ठीक है. So you have to count the like 1001, 1002, 1003, 1004, 1005, 1006. मैंने काउंट किया, पल्स नहीं मिली, ब्रीदिंग भी नहीं मिली. नाउ आई हैव टू स्टार्ट द चेस्ट कंप्रेशंस, दैट इज हाई क्वालिटी चेस्ट कंप्रेशंस. So what are the component of high quality chest compressions that we'll discuss in the later slides. So you have to start the chest compressions. So for starting the chest compression, you have to place your hand. You just draw an imaginary line between the nipples and lower 1/3 of the sternum, and you place your heel, any like कुछ भी आप मतलब dominant heel आप right left कोई भी use कर सकते हैं, and interlace your fingers like this, and you have to stand like this. ये यहाँ पे रखना है आपको, ये interlock करना है अपने elbows, आपको ये interlock करना है, and your pressure, that means the compression force should be generated from the elbow like this. So you can see like this: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So these are the 30 compressions. After 30 compressions, you have to give a 2 breaths. If you are comfortable with the mouth to mouth breaths, you can give. Otherwise, you can use a barrier devices like pocket mask and handkerchief to give a 2 breaths. Okay. Or otherwise, if you have this bag and mask device, you just give 2 breaths like this and this. So 2 breaths. Okay. So these compressions should be given at a rate of 100 to 120 per minutes. So these are the 30:2 ratio, 30 compressions, 2 breaths. So 5 cycles. 5 cycle comprises of 2 minutes. So आपको उतना देना है. ठीक है. So this is the about high quality compression. So जितना आप compress कर रहे हैं उतना ही वापस भी आना है. That is called recoil. So allow complete recoil, means like this. Suppose मैं इतना पुश किया, मुझे वापस यहीं आना है. So 1 second for compression, 1 second for release. Why is it important? Because जो भी आपकी हार्ट की जो फीलिंग होगी जब आप रिकॉइल कर रहे होंगे, तो इंफीरियर वेना कैवा से जो भी ब्लड आएगा वो आपके हार्ट में पंप करेगा. अगर आप उसको रिकॉइल का टाइम नहीं देंगे तो ब्लड विल नॉट come into the cavity. So complete recoil is very important. Now the third thing is minimal interruptions. Minimal interruptions means if you are doing something like you are doing rescue breaths, you don't need to interrupt for more than 10 seconds. Interruptions 10 seconds से ज्यादा नहीं होना है. Because what happens when you start compressions, your cardiac output or blood ejection fraction become increase like this, like this. So अब ये यहाँ पे कोरोनरी परफ्यूजन प्रेशर एक ऑप्टिमल लेवल पे पहुंचा और आपने सडनली स्टॉप कर दिया, देन अगेन कम्स टू द जीरो. सो आपका जो कोरोनरी परफ्यूजन और सेरेब्रल परफ्यूजन है वो जीरो पे आ गया. देन फॉर reaching that optimal level, you have to give again 40-50 compressions. So this duration, this gap is very significant for the survival of the patient. Okay, so you have to minimal interruptions. अगर आप सिंगल रेस्क्यूअर है तो आप कंप्रेशन 32 में करिए. अगर आप दो रेस्क्यूअर है तो आप कॉन्स्टेंटली 100 to 120 रेट से कंप्रेशंस कर सकते हैं. और जो दूसरा रेस्क्यूअर है, द सेकंड रेस्क्यूअर विल गिव अ ब्रेथ्स ओनली. ओके, तो आप उसको कंटिन्यूसली करते रहेंगे, वो एवरी 5 सेकंड पे एक ब्रेथ दे देगा. दैट मीन्स अराउंड 12 जो ब्रेथ्स है वो 1 मिनट में आपके विक्टिम को जानी चाहिए. So this is about the high quality chest compressions. And one more thing, while giving bag and mask ventilation, you have to keep in mind that you don't insufflate the stomach. See, suppose this is mask, this is mask, and this is an ambu bag. You know, this is ambu bag. This is a artery. This is ambulatory manual breathing unit, or you can say artificial manual breathing unit. And this is a mask. So how will you use this mask? This narrow portion will remain on the nostrils, under the nasal bridge, and this broader portion will remain rest on the chest. This is your chin, sorry, chin pe. Okay. So how will you do like this? This is your mask. You can see this rest on this, and this is of the mask is of larger size on this patient. And by E and C technique, you can see this is C and this is E. So C, hold like this, and E, you have to elevate the mandible. So C for compression and E for elevation. So like this, you will hold your mask, and by this you will give the breaths. You can see the chest is rising. Is it visible? So see, you should know the size of this ambu bag. These comes in the different sizes, like some of 2 liters, some is of 1 liter, some 500 ml, depending upon your victim or patient condition. So the normal tidal volume or the normal tidal volume for the adult is around 500 ml. So roughly you have to press 1/4 of this ambu bag for a sufficient ventilation. Suppose if you are insufflating more and rapidly, so what will happen? Some of the air will go into the stomach because the patient is unconscious, and that air into the stomach will distend your stomach, and then it will directly give a pressure to their inferior vena cava, and the venous return will decrease. So this venous return will decrease your blood flow, and it will decrease the cardiac output as well. So the most important thing is avoid excessive ventilation. Don't use the over volume and the rate. So 12 breaths per minute is more than sufficient with just a visible chest rise. A 500 ml tidal volume is more than sufficient. So these are all the components of high quality chest compressions: rate, depth, minimal interruptions, avoid excessive ventilation, and complete recoil. These are all the component of high quality chest compression. Now, after the compressions, your helps arrive and you need to early defibrillate. Early defibrillation means, because most of the cardiac arrest in adult patients having a cardiac reasons behind that. So we thought that because of that myocardial infarction or arrhythmia, your heart stopped. So by giving a defibrillation, what that defibrillation means, the AD, how it works, it stun your myocardium. Okay. And after stunning the myocardium, the heart again resume. So suppose the patient is in cardiac arrest and you give a shock of 120 joule and myocardium stun, and again the rhythm will arise. So there are chances that your patient is having a normal sinus rhythm. So this is all about the early defibrillation. See, so out of hospital cardiac arrest, when your help means the ACLS ambulance will arrive, he will carry this ambu bag and the mask and this AED. This is called, this is AED. This is an automated external defibrillator, and it is different from the defibrillator that we use in hospitals. That is a manual defibrillator. So what is the basic difference between manual defibrillator and AED? AED is a prompted automated device, and it can be used by a layman or any BLS provider, because it will prompt, like, see, you can see this is AED. There is a button, this is a power on and off. So these are the steps. How will you perform an AED? First is on.
Analyzing heart rhythm.
So
do not touch
you
the
can hear
patient.
the prompts. ये क्या बोल रहा है? Analyzing heart rhythm. ठीक है?
Shock advised.
Shock advice.
Charging.
Charging.
Stay clear of patient. Deliver shock now. Press the orange button now.
You can see he's prompting me to press that orange button.
Shock delivered.
Shock delivered.
Paused. Start CPR.
So these are the all commands. So first is you have to power on. Okay. Then these are the pads. These are the two pads. These are called AED pads. These are the adult pads. So first you have to place your pads, one pad at the infraclavicular area and one at the lateral, means axilla ki just niche. See, these are the pad placements. So after the pad placement, you have to switch on and follow the prompts. So what are the prompts? What he will do, the AD machine will do, it will analyze the rhythm. If rhythm is shockable, there is two types of rhythms that is shockable. One is a VF and another is a pulseless ventricular tachycardia. Okay, so these are the only two rhythms that needs a defibrillation. So he will that AED will identify the shockable rhythm and it will deliver the shock automatically. Okay, so this is all about the automated external defibrillator. And if you have the manual defibrillator in your hospital, in manual defibrillator you have to set the joules, you have to identify the rhythms, everything you have to do your own. Okay, so and after that defibrillation you have to again resume the compressions. So in meantime, while you are using this AED, your interruptions will be minimal, means less than 10 seconds. जो आपके पास ये help लेके आएगा, that guy or that the personal, the healthcare provider,
stop CPR,
that will do that work. ठीक है, तो आपको कंप्रेशंस कंटिन्यू करने हैं. जो दूसरा हेल्थ केयर प्रोवाइडर आएगा वो सबसे पहले एडी लगाएगा, एडी लगाने के बाद उसके बाद उसको पावर ऑन करेगा और उसके प्रॉम्प्ट्स को फॉलो करेगा. While the AD is charging, you can resume your compressions, but when he is advising stay clear, that means you have to stay clear from the victim. Okay. And again that you have to resume the chest compressions. Again 30:2 30:2 के रेशियो में आपको compressions resume करने हैं. ठीक है. So this is all about the AED. And after this AED, you have to transfer the victim to the higher centers or to the hospital. Okay. So this is about the out of hospital cardiac arrest situations. Suppose you are in the ये तो आउट ऑफ हॉस्पिटल ही आ रहा है, मूव नहीं हो रहा. ठीक है, कोई नहीं. सो अगर आप इन हॉस्पिटल कार्डियक अरेस्ट सिचुएशंस हैं तो इन हॉस्पिटल में क्या डिफरेंस होगा आउट ऑफ हॉस्पिटल से? द ओनली थिंग इज while you are seeing that your patient is unconscious or not responding to any command, you have to activate the code blue or activate the emergency response system inside the hospital. That is the thing. And you have, while you are doing this all whole CPR, because in hospital you have a team, like you have the doctors, you have the medical ED staff, you have nursing officers, you have the technical staffs. So while doing some of the member is doing the chest compression, some of is doing the airway and breathing part, and some of the taking the IV drugs and sample. So in meantime, you have to rule out the cause. Means what are the causes behind this cardiac arrest? So just by mnemonic, that is 5H and 5T. These are the common things that leads to the cardiac arrest in hospital, like hypoxia, hypovolemia, hypotension, pneumothorax, tension pneumothorax, embolism, pulmonary embolism, okay, toxins. So these are the common conditions, like acidosis, hydrogen ion, acidosis, alkalosis. So you have to treat accordingly. So just by searching these causes, you can find out the underlying causes that leads to the cardiac arrest situations. So these are the two basic differences between the out of hospital and in hospital. The rest of the things will be remain same. So you can see, while you are doing out of hospital cardiac arrest, you have to ensure the safe place. So what do you mean by ensure the safe place? Means the place where you are performing the chest compression should be safe for your victim as well as you. So suppose you are starting the compression on the middle of the road. You find a victim that is on the middle of the road and you start chest compressions there, and some vehicle comes and hit to you. So this is not a safe condition. So what you will do, you will just bring your victim to the roadside and then you start the chest compression. So whenever you start these chest compressions or you perform CPR, the place should be safe. So the first and foremost thing is ensure safe place while you're doing out of hospital cardiac, dealing out of hospital cardiac arrest situation. But if you're dealing ensure this in hospital cardiac arrest, then you no need to emphasize on the scene safety. That is called scene safety. Now again, after in out of hospital, you have to see the check responsiveness, as I already mentioned you, by tapping on the shoulders or by the verbal command. So scene safety, ensure the scene is safe for you and your victim. You can see the look around the site of imminent danger, like if it is like drowning, burning, or something else. So you have to see that the safe is this your scene is safe, and you shift your victim on a firm and flat surface. Why firm and flat surface? Because if surface is undulating while you are giving chest compressions, that will be not effective. So the surface should be flat like this. You can see the stable. This is firm and flat. So my compression will be more effective. So same thing you have to see. Like suppose the cardiac arrest, this situation happens in your home, and your near and dear one is on the lying on the bed, like this cushion bed hota hai. So what you have to do, आप उसको floor पे ले आइए. Don't start chest compression on the bed only, because what happens, you will not be effectively give the chest compression. That means the high quality chest compressions. So आपको firm and flat surface पे ही victim को लेके आना है, ठीक है. And check responsiveness, as I already mentioned. Approach from the front, as I tap on the shoulders, speak loudly, are you okay, in the language victim that he could understand, and should not shake or neck movement done. Why? Because especially in the road traffic accidents, while you are dealing with the RTA patients, because they might be having a cervical spine injury. So if you are moving the neck, the cervical spine may be uh, dislocated and the patient get in the cardiac arrest situations. Okay. So keeping in mind, if you are dealing with the RTA patient, place the head collar. So see, you can see this is a scene safety, check responsiveness. If your victim is not responsive, then call for help. That is the next step. And if it is responsive, that means you just put him in the recovery position or wait and watch for the facility arrive. And if your patient is not responsive, then again, you should call for help, inform EMS or ambulance, and you give the full details, as I already mentioned, that you have to mention the name, the place where you want to be ambulance arrived, and all the medical help you need. Don't hang up till that means the close communication till happens. If available, then instruct the inform and EMS. So this is all about the out of hospital cardiac arrest. Call for help हुआ, then simultaneously आपने breath और pulse देखा. Normal breathing with definite carotid pulse. Don't need to start the chest compression. Just put him in the recovery position. But if there is abnormal breaths or gasping breaths or no breaths, but he's having a pulse, then provide a rescue breaths, one breaths every 5 seconds, means 10 to 12 breaths over 1 minute. And if there is no breaths, no pulse, then start chest compressions. 5 cycle करनी है 30 compressions की over the 2 minutes. And then again, you have to check the pulse, that whether my patient revived or not. So this is the algorithm regarding the out of hospital cardiac arrest. So identify the carotid pulse, मैंने आपको पहले ही बता दिया, 5 to 10 seconds, not more than 10 seconds. During this pulse check, you have to see the respiration also. Abnormal breathing or a gasping or agonal breaths are the definite absence of carotid pulse. That means, suppose if your patient is in gasping breaths, so you can easily think that my patient or my victim will be land up in the cardiac arrest conditions anytime. So if the presence of pulse and breaths cannot be determined, assume the victim is in cardiopulmonary arrest. So you have to start the high quality chest compressions. So these are the all components of high quality chest compressions that I already told you and demonstrated you. Like push hard means at least 5 centimeter or 5 to 6 centimeter. So how will you confirm that it is sufficient enough? Kitna 5 centimeter ho gaya? There are feedback devices. You can see these are the feedback devices came with the mannequin. If you effectively, you can see here, it is showing depth and rate. If you will adequately do the chest compressions, it will become green. Otherwise, it will become red. So अगर आपको कुछ भी समझ में नहीं आ रहा है, तो you just see कि जो anterior posterior diameter है, उसका 1/3 हम compress करें. So this is about 5 to 6 centimeter. Rate 100 to 120 compress करना है. Heel कहाँ place होना चाहिए? मैंने आपको बताया lower half the sternum, or you can draw an imaginary line. Allow complete recoil, that I already tell you. Interruption should be minimal. Regarding the breaths, One breath will be delivered over the 1 second. Excessive ventilation avoid करना है. 1 second आपको exhalation के लिए भी देना है. Compression will be restarted immediately without waiting for the exhalation because the minimal interruptions. अगर आपके पास 2 rescuer है तो आप rotate कर सकते हैं because you will be fatigued after giving a 5 cycles of chest compressions. Okay. So this is our algorithm. How will you use a defibrillator? Like you have to, while using AED, you have to attach the pads. This AED will analyze. While attaching pads, don't stop chest compressions. While analyzing the rhythm, don't touch the victim, because if you will touch or you will give chest compressions, that will not, this AED will not analyze the rhythm. So while the AED is prompting that analyzing heart rhythm, so आप जो victim को touch नहीं करेंगे. Give AED time to analyze the rhythm. Then AED will decide that rhythm is shockable or non-shockable. So अगर shockable rhythm है, then it will automatically give shock, and non-shockable है, then it will advise that there is no shock advised. Resume your chest compression. So you will resume your chest compression in the rate of 30:2. Okay. Continue the cycles till the victim become responsive. So how will, like moving, if he is moving his limb or hand, that means again you have to check the pulse, that okay, now pulse is there, then the keep your victim in the recovery position, or to the and shift the patient to the higher center or medical facility. So this is all about the AED, how you use the AED. So AED, initially you have to power on, attach AED pads. AED will analyze the rhythm. During this analyzing, do not touch. This AED will administer the electric shock and prompted by AED. And again, you have to resume the compressions. So what are the major obstacles? These are the all theoretical things, like we have the large population size, illiteracy, and the availability of the trained staff and AEDs. See, in most of the scenario, like railways, airports, you will find an AED. It will place at the top, like everybody can see and use it. Cultural beliefs, log mouth to mouth breaths देने में hesitate करते हैं, but if you hesitate the mouth to mouth breathe, you just give a chest compressions only. It will be more effective. कुछ ना करने से कुछ करना ज़्यादा better है. Though skill is not difficult to acquire, but inappropriate use may result in more harm. Inappropriate use means अगर आपको chest compressions का hand placement नहीं पता, तो आप क्या करेंगे, ribs के ऊपर हाथ रखेंगे और ribs को तोड़ देंगे. So that fracture of the ribs might lead to the your hemothorax and all. So it will be further deteriorating for the victim. So these are the compression only life support. In that, if you don't have AED, you just give chest compressions only, early chest compressions. This is in Hindi language. You can see कि आप जो है response देखें, chest 108 को call करें and start chest compressions only, 30:2, 30:2. Okay. This is all about the in-hospital cardiac arrest. So the only difference between the out of hospital and in hospital is management of pre-arrest conditions. That are the causes that leads to the cardiac arrest. That is hypoxia, hypovolemia, embolism, stroke, MI. Okay, these are all the conditions you have to manage. And rest of the steps are the same. Either it is out of hospital or in hospital. So the second step is early recognition. That is also same. And in that out of hospital, you are activating, you're calling 108. In hospital, you will call your emergency number or code blue if you have the code blue in your hospital. And again, you have to start the chest compressions, defibrillation, and shift the patient or transfer into the like coronary care unit or ICU, whatever is required. So this is the algorithm. How will you go with the in-hospital cardiac arrest situations? So in hospital means you have all the facilities like drugs and all. So if you have the like nursing officers, technicians, so you will take a venous access. One person will manage the airway, one person will be on the drugs. So if your victim, your patient is not reviving, you give a 1 milligram of adrenaline at every 3 to 5 minutes. And for arrhythmias, refractory VFVT, you give the defibrillation at 120 joules and give amiodarone 300 milligram bolus, and then the repeat of 150 milligram. And what are the reversal causes? As I already mentioned you, and you can send your patient to the post resuscitation care. So this is all about the adult BLS. Now,
Sir, before, just sorry for interrupting. These students you had trained that can be ones so that the mistakes they do, if they can do it
Okay,
earlier
okay.
and people can see it. Many
Yes.
students,
हाँ,
that
हाँ.
would be better. Na?
Yeah.
Just,
बोला नहीं?
हाँ जी sir, यहीं
अच्छा
है.
अच्छा.
There is a, I'm sorry for the interruption. We will give sir 5 minutes break. The students of second year BMS from IMS BHU are here with me. Mr. Ayushman and Aditi.
अच्छा बेटा.
Idhar aaja. So recently they had visited the skill center here and they have learned the procedure of CPR. So they will be performing it so that you people can see it properly. And whatever sir has said until now and sir has shown you, they have learned it. Maybe they are wrong. They will make some minor mistakes also and sir will be looking at them and correcting them. So in this way, maybe even teachers and staff and all of us can know what is the actual procedure. Shuru se call the ambulance and all those.
Okay, okay.
Scene,
मैं
everything.
just like I gave you scenario ना. Yes. So मैं एक scenario देता हूँ आपको, ठीक है? जैसे मैंने आपको वहाँ एक scenario दिया था कि same after just learning the BLS, you are going out and you saw that a 60-year-old male that is lying in middle of the road.
Okay.
So how will you approach that victim?
Okay. So first of all, we will take the patient or the person on the safer side of the road, or
Camera.
on the safer side of the road, and then we will tell somebody, or
थोड़ा नजदीक ही रखिए.
then we will tell somebody to call the ambulance or emergency number, and then we will check the three vitals.
First, you have to ensure the scene safety.
Yes, sir.
Yes. हाँ. So
Safer
see,
side.
हाँ. तो आप उसको victim को side में ले आएंगे.
Yeah.
So ensure the scene safety.
So,
Then,
so when the scene safety is ensured,
yes.
then we will tell the someone or call, if only one person is present, then I will first call the emergency.
Before calling the emergency, you have to see the responsiveness.
Okay.
Okay.
Yes, sir.
But because why you need help?
Yes, sir.
Because maybe he's lying.
Yes, sir.
As it is.
Okay.
Like वो सो रहा ही हो, क्या पता?
Yes, sir. So to check the responsiveness, we have to check the three vitals first. So first you have to ask, are you okay? And if it does not respond, then we have to check, is his breathing or not breathing? So and is his pulse is continuing or not continuing? So this can be done. The pulse can be
Ask
checked
him
by
properly,
this.
are you okay?
Hello, are you okay, sir?
Shoulder पे tap करना है.
Yeah. Hello, are you okay, sir? Are you okay? So as you can see, the person
So he
is
is not responding.
So now we will check the pulse rate.
Now call for help.
Yeah.
Yes.
Now we will call for help and tell the person about the place where there is
Yes.
the accident has taken place.
Ayushman, 1 minute. Because you have one more person along with you, you can ask her to call for help while you do the checking of the pulse.
Please,
Yes, Aditi, please call. Do that, Aditi. Call for help.
Yeah, please call for help on the helpline number, and I will continue by checking the pulse rate, and also I will at the same time I will also check his is he breathing or not by simply tilting my head, and is there is any abdominal movement or not. If there is no pulse rate detected, and also there is no breathing is observed, then I will continue with the CPR. So for doing the CPR, first of all, if there is no machine as available, because the accident has taken place on the roadside, so I assume that no other machines are available, so only manual help can be done. So for this, first I have to tilt the person's head slightly upward and clear his airways, and then by putting my dominant hand down and on the lower part of the sternum, I will continue the CPR on the cycle of 30:2, like
count
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
and 2 breaths. Yes.
And then again we will continue. For this we have to take the depth should be 2 to 3 inches approx.
Yes, at least 5 to 6 centimeter. ठीक है, अभी आपका हेल्प भी आ गया, अदिति आ गई।
बैग के साथ
हाँ, यस, ये अदिति जो है एडी लेके आ गई और एम्बू बैग लेके आ गई। अब कैसे हम लोग एडी और एम्बू बैग का यूज करेंगे? आप कंप्रेशंस पे ही थे, ठीक है। आप एडी लेके जब लेके आते हैं तो क्या करते हैं?
So like we will not stop that CPR cycle while like putting the ambu bag or AD, and while calling to the helpline number, we will tell them to bring like AD and ambu bag as well. So basically ambu bag is called as artificial manual breathing unit. So like for the safety of the individual who is giving the CPR, ambu bag is needed. So we will apply ambu bag like
Yes.
this, so that the whole mouth and that conical part covers the nasal septum, and the whole mouth part is covered. And then we will tilt the head of the patient,
ऐसे
head of the person.
ऐसे पकड़ो,
side.
Yeah. Then we will have
C and E. This is C and E technique. Okay. Mandible पे, yes, like this.
उसको एक बार बोलो बेटा, अपने उंगली को ऐसे ऊपर उठा के दिखाओ, C and D technique.
C.
Like this left hand only you just
जैसे
put
आपने
it,
पकड़ा है,
जैसे ये पकड़े हम. Lift this up and show it on the camera how you are
बस हाथ
holding
ऊपर कर
this
लो, हाथ अपना ऊपर कर लो।
position.
So this is like this finger goes to the mandible, like it will support the mandible of the patient.
So this is C and this is E. C compressed, E is elevated.
Elevation. Then we will
Yes, very good. You can see the chest is rising.
so like this we will
Okay, and how will you
provide the
attach the AED?
the AD contains actually two parts. So first of all we apply the AD on the upper part of the patient chest, and second one on the lateral side. And then we will on that AD, and then we will follow all the instructions given by the AD.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Paused. Start CPR.
Start chest compressions.
CPR.
Elbow lock, elbow. So height
वो
आपका
height
ज़्यादा,
है. तुम ही
height
करो
ज़्यादा है,
आयुष्मान, तुम
yes.
करो.
Count.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Yes. If you have now ambu bag,
Ambu
so you
bag,
can.
then
So we will continue with the ambu bag also.
So good. This is good. So clap for them.
Clap for you, sir. You have taught them so well, and my students are able to.
So I think this is all about the BLS, or
But
now we can ask questions if they have. So
this
that will
was
be
about the
because-
procedure of CPR. Now, if somebody has any doubt or wants to know something, maybe you can unmute yourself and ask queries. If not, we will go into the next procedure of gastric lavage.
So you can ask any questions if you have any doubt in your mind regarding the CPR and all, or you face some difficulties while performing any CPR, your personal experience you want to share. So you can ask anything here.
Hello, sir.
Yes, yes. Hello.
Hello, sir. I'm Dr. Ashish Goswami.
Yeah.
I'm also the co-host in this webinar. Sir,
Hello.
actually, I want to ask, one of my friend told that before 2010, there was a guideline regarding ABC, airway, breathing and circulation. And after 2010, it has been changed to CAB, circulation, airway, then breathing. Is it correct or, sir?
Yes, yes. Actually, initially it was airway, breathing and circulation, or compression, you can say.
Stop
Because
CPR.
what happens, they are focusing
Analyzing
more on the
heart
airway.
Stay.
They are more focusing on the airway. But later on, so many RCTs have been done, and they found that the compression is much and more effective than the breathing only. So they did compression, airway and breathing. So they are more emphasizing on the compressions right now. So high quality chest compression, or you can say currently there is hands-on compressions or compression only life support, that is calls. So this is now compressions. They are more focusing on the chest compressions, high quality chest compressions. So this is the CAB. Initially it was ABC, airway, breathing and circulation. ABC is you have to perform in a conscious or the victim. You can see if a patient who comes to you in a ED, in an emergency department, and he suddenly felt became unconscious in front of you, then you can go with the ABC. But if you are founding a victim who is remain unconscious from last 2 or 3 minutes or 5 minutes, so you initially do a chest compression, then go to the airway. So here chest compression is more emphasized in this after 2010 guidelines.
Thank you, sir.
Any more questions if you have?
Is everybody clear on the procedure of CPR? If not, if you want a demonstration once again, we can do it. Are things clear?
See, only 3 or 4 things you should know: hand placement, rate, depth, and minimal interruptions. This is only the 4 component of chest compressions you should know, and when you have to perform, in which category of victims, and the steps. You should not miss any step. Okay.
Can we continue? If there are no more questions?
सर
Yes, yes.
यस सर 500 ml जो टाइडल वॉल्यूम है वो हम
हाँ।
लोग को अंदर प्लेस करना है, तो वो हम लोग कैसे मतलब आइडिया लगाएं कि 500 ml कितना
हाँ।
कंप्रेस करें
बिल्कुल
अम्बू
बिल्कुल।
बैग को?
मैंने आपको बताया था बीच में भी ना, जस्ट लाइक सी दिस इज एम्बू बैग ऑफ 2 लीटर, है ना, आपको
जी,
पता हो एम्बू बैग का 2 लीटर है, तो 500 ml 1/4, तो आप उसको
जी।
उतना ही दबाइए कि 1/4 ये बस जाए। और आपको टाइडल वॉल्यूम पे भी फोकस ना करके देखना है कि इतना दबाने से मेरा विजिबल चेस्ट राइज हो रहा है। दैट मीन्स
जी।
अगर विजिबल चेस्ट राइज मिल रहा है तो दैट इज सफिशिएंट फॉर वेंटिलेशन। ठीक है, क्योंकि जब हम लोग नॉर्मली भी ब्रीथ करते हैं तो जस्ट एक विजिबल चेस्ट राइज होता है, फोर्सफुल इंस्पिरेशन करते हैं तब जाके वो होता है। ठीक है, तो हमको विजिबल चेस्ट राइज देखना है, तो एक तो आप इससे विजिबल चेस्ट राइज से देख सकते हैं, और आपको जो 1/4 ऑफ जो आपका जो एम्बू बैग है उसको प्रेस करना है, दैट इज सफिशिएंट।
थैंक यू
सर।
Yes.
यदि ब्लीडिंग हो रही है नोज से, उस कंडीशन में सर क्या कर सकते हैं?
ब्लीडिंग हो रही है तो भी आपको ब्रीदिंग देनी है, कंप्रेशंस देने हैं। अगर आपका विक्टिम अनकॉन्शियस है, यू द ओनली थिंग यू कैन डू इफ यू हैव द सक्शनिंग डिवाइस, अगर इन हॉस्पिटल में है तो आप सक्शन करके उसको निकाल सकते हैं, फिर बैक एंड मास्क करिए। अदरवाइज अब आप आउट ऑफ हॉस्पिटल में है तो आप कुछ नहीं करना है, आपको कंप्रेशंस देने हैं और ब्रेथ्स देना है। आपको ब्लीडिंग पे ध्यान नहीं देना है। इन हॉस्पिटल है तो सक्शन करना है आपको, बिकॉज आपका पेशेंट जो है कार्डियक अरेस्ट में है, तो आपके कंप्रेशंस जो है उसकी लाइफ सेव करेंगे.
Okay, sir. Thank you, sir.
Anyone?
Any other queries? ठीक है.
So if gastric lavage तो
सर एक बार हैंड प्लेसमेंट लोकेशन बता दीजिए ना, फिर से समझ में नहीं आ रहा.
yes, I will show you. See, this is your victim, this is mannequin. You can see, आपको दिख रहा है मैनिकिन? आप एक लाइन
सर दिख रहा है
ना, तो आप यू कैन सी निपल्स ऑफ दिस मैनिकिन. एक इमेजिनरी लॉ जो लाइन है वो ड्रॉ करिए इन दोनों में, और उसके बाद जो लोअर 1/3 ऑफ स्टर्नम है, बस वहीं पे आप हैंड प्लेसमेंट करना है ऐसे. ठीक है, और वहीं पे आपको कंप्रेस करना है. तो जो आपका हार्ट है वो स्टर्नम और डायफ्राम की जो कैविटी है, जो स्पाइन है पीछे, उसके बीच में कंप्रेस होगा. ठीक है, तो स्टर्नम पे आपको प्रेस करना है.
और एल्बो एकदम without bending your elbows and straight.
Yes, your elbow should not be bent, and force should be generated from the shoulders. शोल्डर पे आपका हिंज मोशन होना चाहिए, शोल्डर से प्रेस जो है होना चाहिए. और जो आप पेशेंट के जितने भी विक्टिम के जितने क्लोज प्रॉक्सिटी में रहेंगे उतना ज्यादा बेटर होगा. ठीक है, और साइड से हमेशा कंप्रेशंस देने, कभी भी ऐसे नहीं इधर आके कंप्रेशन नहीं देना है. कुछ लोग ऐसे आके कंप्रेशन देने लगते हैं. दिस इज नॉट अ करेक्ट मेथड, दिस इज द करेक्ट मेथड.
Because we have a table today, maybe we are not able to show it perfectly. If it is on the ground, it can be done easily. The table height is
You will be on your knees and you will be आप अगर कुछ होता तो हम लोग दिखा सकते थे इनको.
यही तुम लोग दिखा दोगे क्या बेटा? कैमरा वहाँ,
यहाँ लाना.
हाँ वहाँ कर दीजिए, वहाँ ले लो.
हाँ,
Just 1 minute ना, we'll try doing it then. इसको आराम से ले जाओ. ये हम ध्यान नहीं दिए ना, तो ये भी वहाँ आपके स्किल सेंटर में एकदम परफेक्ट है.
हाँ, यहाँ पे बस ऐसे
बस जस्ट
आप कैसे जो है
दो लोग इधर उधर से कर सकते हैं.
बस यहाँ से एक बार बैठ के और हैंड प्लेसमेंट बस ये दिखा दो. यस,
हम लोग नीज पे बैठ जाएंगे और उसके बाद जो हमारा डोमिनेंट हैंड होगा उस पे हम लिखेंगे स्टर्नम के लोअर वन पे, और उसके बाद ऐसे
कंटिन्यूस करो बेटा 2 साइकिल. 1 2
3 4 5 6 7 8 9 11 12 13 14 15 16 17 18 20 21 22 23 24 25 26 27 28 29.
गुड.
If you can look at his hands, he's not bending his hands on his elbows. It should be straight. He is also sitting straight.
6 7 8 9 10 11 13.
आपको भी सीखना चाहिए.
नहीं बस. I hope it is clear now. ऐसे कितने साइकिल्स करे, कब तक करे, वो थोड़ा.
Actually, see, it's depend upon the victims. Like अगर आपको लग रहा है कि मेरे विक्टिम की जो एज है वो यंग विक्टिम है, तो you can go up to 20 to 30 minutes. बट अगर आपका विक्टिम ओल्ड एज का है और आपको लग रहा है कि कोई साइंस नहीं आ रहे हैं लाइफ के, तो आप जो है 15 से 20 मिनट करने के बाद भी, और टिल यू गेट फटीग, जब आपको लगे कि मुझे खुद सीपीआर की जरूरत पड़ सकती है, तब तक आप बंद कर दीजिए. ठीक है, कोई मतलब ऐसा कोई क्लियर कट गाइडलाइंस नहीं है कि आपको कब तक करना है, क्योंकि ये तो एक सेवा है, जब तक आप कर सकें.
Sir, for children and the babies.
Yes, for children and babies, you have to see there is only two difference in children's. Basically, for infants, in infants the ratio is 15:2. Means you will give 15 compressions, 2 breaths, and 15 compressions, 2 breaths. If you have having 2 rescuer, and if you are the lone rescuer, you will give a 30:2 compressions, and your hand placement is like a 2-finger technique or thumb insert class technique. Like 2 finger, you can see this, and you will press it like this. एंड इन थंब इंसर्ट क्लास, बिकॉज आपका जो इन्फेंट है बहुत छोटा होता है, तो आप जो है बेबी को ऐसे बैक लेके और ऐसे करके लाइक दिस. So this is, there is only difference in the children and infants, that is the rate and depth. इन उनमें डेप्थ जो है आइडियली 1/3 ऑफ द एपी डायमीटर आपको कंप्रेस करनी है. ठीक है. So the ratio is 15:2 if you are 2 rescuer and 30:2 if you are having a 2 rescuers. Okay.
And the placement for the AED is also front and back.
Front and back depending upon what pad you have. If you have the adult pads, if you don't have the infant या pediatric pad, then you have to give the anterior posterior like this, anteriorly and posteriorly. But if you have the pediatric pad, you can place it like this only, anterior lateral also. These are the two placement. One is anterior lateral, anterior posterior. तो आप दोनों कर सकते हैं. अगर if you don't have the pediatric pad, pediatric नहीं है तो आप अगर आपके पास adult ही है तो adult को ही यूज करिए anterior posterior में.
Okay, sir.
Hope that completes the procedure of CPR.
Anji.
So we will run out of time. Sir.
Yes, yes.
So maybe the other questions you can write down
Gastric
to us
lavage
anytime,
तो
and we
बहुत
will call
छोटा
sir
सा ही.
once again. Just a small demonstration on the procedure of gastric lavage as well.
गैस्ट्रिक लवाज आपको किस किस कंडीशन में करना पड़ता है? मोस्टली व्हेन योर पेशेंट इज हैविंग एनी टॉक्सीमिया, कुछ भी टॉक्सिन्स लेके आ गया तो वहां पे आपको गैस्ट्रिक लवाज करना है. सो व्हाइल डूइंग अ गैस्ट्रिक लवाज यू हैव टू बी वेरी, you have to see 2 or 3 things. Like if your patient is unconscious, your airway should be protected, means your patient should be having intubated or like आपको intubated होना है और कफ जो है inflated होना चाहिए, otherwise aspiration हो जाएगा. ठीक है. And one more thing, that you have to see the which size of Rice tube. This is called Rice tube. It comes in a different sizes. आपको pediatric patient से लेके adult तक उसमें यूज कर सकते हैं. तो like 18 French की जैसे Rice tube है आपको, तो आपको Rice tube देखना है, उसमें मार्किंग्स देखनी है. उसमें मार्किंग्स एडल्ट में 50 से शुरू होती है. ठीक है. 50 सेंटीमीटर्स, 60 सेंटीमीटर्स एंड दिस इज 70 सेंटीमीटर्स. ठीक है. तो राइस ट्यूब पे क्या क्या चीजें मेंशंस होती हैं? यू कैन सी दिस टिप. ये राइस ट्यूब का टिप है, आप देख सकते हैं. दिस इज अ ब्लंट टिप. ये ब्लंट इसलिए है क्योंकि अगर आपके ईसोफेगस से होकर जा रहा है, आपको कोई भी कोरोसिव जो है या कोई भी इंजरी जो है, अगर आपका पेशेंट को मान लीजिए डीआईसी है, उसका आईएनआर बहुत ज्यादा बढ़ा हुआ है, तो आप अगर हल्का भी अगर इससे इंजरी होगी तो जो है हैमरेज हो सकता है, इंटरनल हैमरेजेस. तो इसलिए आपका इसका टिप जो है ब्लंट होता है. एंड दीज आर द पोर्ट्स, दीज आर साइड पोर्ट्स फॉर सक्शनिंग और डिलीवरिंग. राइस ट्यूब किस किस काम में आती है आपके? आप एक तो लवास करना चाहें तो लवास के लिए, और पेशेंट को फीडिंग के लिए. ठीक है. जब आप एंट्रल फीडिंग देते हैं तब आप राइस ट्यूब का यूज करते हैं. ठीक है. तो आप इसके थ्रू फीड भी कर सकते हैं. तो आपको जब आपको कैसे अपने जो पेशेंट को प्रिपेयर करना है, तो आपको पेशेंट को प्रिपेयर करना है, सबसे पहले उसकी नेजल पेटेंसी चेक करनी होती है. अगर आपका जो पेशेंट कॉन्शियस है, ठीक है, कॉन्शियस है, ओरिएंटेड है, तो आप उससे पूछ सकते हैं, हिस्ट्री ले सकते हैं कि आपको किस ऐसे उसके एक नोज पिंच करके पूछेंगे कि आपको इस नाक से अच्छी सांस आ रही है कि इस नाक से. तो जिस नॉस्ट्रल से वो बोले कि मुझे इससे, क्योंकि पेशेंट में हो सकता है डीएनएस हो, डीएनएस डेविटेड नेजल सेप्टम हो सकता है, तो आपको वो साइड अवॉइड करनी है. ठीक है. तो अब अगर आपको पेशेंट ने बता दिया कि मुझे इससे अच्छा आता है, तो आप वही नॉस्ट्रल यूज करिए. आइदर इट वुड बी राइट नॉस्ट्रल और लेफ्ट नॉस्ट्रल, कोई भी नॉस्ट्रल हो सकती है. उसके बाद आपको अपराइट पोजीशन में कोई भी जेली, जैसे हमारे पास ये लिग्नोकेन जेली है, दैट इज अ लोकल एनेस्थेटिक जेली. इससे पेन भी नहीं होगा पेशेंट को, और ये जेली का भी, तो आप लोकल एनेस्थेटिक जेली जो है उसकी नॉस्ट्रल में डाल सकते हैं. ठीक है. प्रिक कर दो इसको,
पेन से पिक कर.
ठीक है. तो आपको जेली यूज करनी है और पेशेंट को अपराइट पोजीशन में रखना है. ठीक है. और उससे पहले एक चीज और भी आपको, जब आप लवास कर रहे हो तो आप कैसे साइज मेजर कर सकते हैं। एक रफ आइडिया होता है जनरली कि आपका जो एंट्रम होता है वो अराउंड 60 सेंटीमीटर पे आता है एडल्ट्स में। बट अगर आपका ओबीस पेशेंट है या कुछ है तो आप एक तरीका और भी है कि आप अपने नॉस्ट्रल से, ये नॉस्ट्रल है, नॉस्ट्रल से लेके फिर ईयर लोब से इसको लेके और जो आपका एंट्रम है लाइक दिस, यू कैन सी दिस इज रफली 65 सेंटीमीटर। यू कैन सी, आपको मार्क दिख रहे हैं 60 सेंटीमीटर यहाँ पे। हाँ, ये देख सकते हैं इधर, ये 60 सेंटीमीटर, तो ये रफली आपका 60 सेंटीमीटर पे आ गया। तो आप एक रफ आइडिया है कि आप ऐसे भी आपकी जो ट्यूब की, जो राइस ट्यूब की जो लेंथ है उसको मेजर कर सकते हैं। ठीक है, अब आपने अपने पेशेंट को, विक्टिम को, जो पेशेंट को प्रिपेयर कर लिया, आपके नॉस्ट्रल में उसको जेली डालने के लिए जेली डालना है। उसके बाद 90 डिग्री, ठीक है, सी आप लवास करने के लिए ओरोगैस्ट्रिक यूज ये डाल सकते हैं राइस ट्यूब, और नेजोगैस्ट्रिक भी। ओरोगैस्ट्रिक मीन्स आपकी ओरल कैविटी से जाएगी एंट्रम में, नेजो मीन्स नेजल कैविटी से जाएगी। तो आपको किस जो पेशेंट है उसमें नेजल डालना है, किस में ओरल। लाइक अगर आपको लग रहा है कि पेशेंट को हेड इंजरी है और सीटी नहीं हुआ है, तो उसमें क्या हो सकता है कि उसकी क्रीबिफॉर्म प्लेट में फ्रैक्चर हो सकता है, मान लीजिए। तो वो होगा क्या, जैसे आप नॉस्ट्रल से डालेंगे वो क्रीबिफॉर्म प्लेट के थ्रू ब्रेन में चली जाएगी। देयर आर few case reports that have been published in journals. So in that victims or in that patients, you avoid nasogastric tube till CT performs. Okay, जब तक कि CT आपको नहीं मिल जाता, CT में क्लियर कट क्रीबिफॉर्म प्लेट दिख नहीं जाती, तब तक आप ओरोगैस्ट्रिक डाल सकते हैं। बट अगर आपका कोई आरटीआई का हिस्ट्री नहीं है, नॉर्मल पेशेंट है और आपको पता है कि जस्ट पॉइजनिंग से आया है, तो आप सिंपली जो है आप उसको करके 90 डिग्री आपको इनिशियली जाना है, ठीक है, टिल रेजिस्टेंस फील। उसके बाद पेशेंट अगर कॉन्शियस है तो उसको बोलना है टू स्वेलो, ठीक है। तो जब वो स्वेलो करेगा तो वो ऑटोमेटिकली जो है पेशेंट के ईसोफेगस में चली जाएगी। और 60 सेंटीमीटर आपने मार्क कर लिया, 60 सेंटीमीटर जाने के बाद उसको नाउ व्हाट यू हैव टू कंफर्म, आपको अब आपने जो ये नेजोगैस्ट्रिक ट्यूब डाली है, अगर ये आपका विक्टिम अनकॉन्शियस होता तो कहां कहां जा सकती थी, लंग्स में जा सकती थी। तो लंग्स में अगर अनकॉन्शियस होगा तो पता नहीं चलेगी आपको, ठीक है। और अगर आपने उसी के थ्रू उसको फीडिंग दे दिया, कुछ कर दिया, या कोई भी नॉर्मल सलाइन या गैस्ट्रिक लवास किया और फ्लूइड दे दिया, तो वो लंग्स में एस्पिरेशन न्यूमोनाइटिस कर सकता है, ठीक है। तो ऐसे पेशेंट्स में अनकॉन्शियस में जनरली अवॉइड करते हैं अनटिल अनलेस डालने से पहले आपको एयरवे सिक्योर कर लेना चाहिए। एयरवे कैसे सिक्योर करते हैं, एंडोट्रेकियल ट्यूब डालने के बाद, ठीक है। बट अब उसके बाद अगर आपका कॉन्शियस है तो आप सिंपली डाल सकते हैं। उसके बाद आपको ये 50 ml की 60 ml की जो सिरिंज है उसको लेना है, आपका स्टेथोस्कोप होना चाहिए आपके पास, एंड यू जस्ट इसमें एयर फिल करना है और चेक करना है, ठीक है। तो आपको यहाँ गर्गलिंग साउंड आएगा एंट्रम पे, तो आप अपने साथ में जो कलीग है उसको बोल के स्टेथोस्कोप से जो है चेक कर सकते हैं गर्गलिंग साउंड के लिए। तो अगर गर्गलिंग साउंड एंट्रम में आ रहा है, दैट मीन्स योर राइस ट्यूब इज इन सेफ प्लेस, ठीक है। और अगर नहीं आ रहा है तो दैट मीन्स कुछ प्रॉब्लम है। तो अब प्रॉब्लम कहाँ कहाँ आ सकती है, पहली तो लंग्स में जा सकती है, ठीक है। दूसरा जनरली होता है ये नेजोफेरिंक्स में कॉइल हो जाती है। तो अगर नेजोफेरिंक्स में कॉइल हो गई हो, तो अगर पेशेंट कॉन्शियस है तो आप उसको माउथ ओपन करने के लिए बोल सकते हैं। अगर अनकॉन्शियस है तो जस्ट सी that it is in the nasopharyngeal cavity or not, and if you have the laryngoscope, so you can do a laryngoscopy and see. And one more thing, that if your victim is intubated and there is a difficult rise tube insertion, you can use laryngoscope for that also. So for that you just do a laryngoscopy, and there is a Magel forceps we have. सो आप मैगल फोर्सेप्स से उसको लैंजियोस्कोपी करके मैगल फोर्सेप्स से पुश कर सकते हैं ईसोफेगस में, एंड स्लोली इसको जो है आगे पास कर सकते हैं, ठीक है। सो दिस इज ऑल अबाउट हाउ टू पुट एन राइस ट्यूब इन एन कॉन्शियस और अनकॉन्शियस पेशेंट, ठीक है। अब आपको कॉम्प्लिकेशंस क्या हो सकते हैं, ईसोफेगल हेमरेजेस हो सकते हैं, वेरिसेस हो सकते हैं, पेशेंट का डीआईसी में हो सकता है, तो आपको ब्लीडिंग हो सकती है। तो ये सारी चीजें आपको ध्यान में रखनी है while you are performing a nasogastric tube insertion. थोड़ा ब्लीड हो सकता है, कोई वो नहीं है, वो ऑटोमेटिकली कंप्रेस, अगर उसके लिए आपको कंसर्न नहीं रहना है. अगर ब्लीड हो रहा है और आपका एयर भी सिक्योर नहीं है, तो वो और अनकॉन्शियस विक्टिम है, तो वो लंग्स में जा सकता है. तो उसके लिए आपको एयरवे सिक्योर कर लेना है या फिर जेंटल सक्शन करना है. ठीक है. और कई बार विक्टिम का जब एयरवे सिक्योर नहीं होता है, तो जब आप एनजी डालते हैं तो उससे उसकी वॉमिटिंग सेंटर जो स्टिमुलस जो होती है, तो वॉमिट भी कर सकता है विक्टिम. तो उसके लिए आपको रेडी रखना है जो है सक्शन कैथेटर्स, लार्ज बोर सक्शन कैथेटर्स आपको रेडी रखने हैं, जिससे कि आप तुरंत से उसको सक कर पाए. ठीक है. So this is all about the how to put a NG tube in a patient's, either he is conscious or unconscious. If you have any queries regarding the insertion and all, so you can ask for the.
Any queries regarding
NG insertion, the procedure of gastric lavage. अब gastric lavage generally जितनी भी जो अमेरिकन टॉक्सिकोलॉजी है उन्होंने अवॉइड करने के लिए बोला है, बिकॉज इट क्रिएट्स मोर हार्म. लाइक अगर आपका क्लोराइड पॉइजनिंग, एक्सियल पॉइजनिंग है, तो उसमें तो बिल्कुल नहीं करना है. और अगर आपका पेशेंट विद इन 30 मिनट्स या विद इन 1 आवर आपके पास आ रहा है, तो आप गैस्ट्रिक लवाज करिए. अदरवाइज जस्ट कीप इट, यूज एंटीडोट्स एंड ऑल. तो एंटीडोट्स आप यूज कर सकते हैं या एक्टिवेटेड चारकोल यूज कर सकते हैं. ठीक है. मोस्टली क्योंकि मोस्ट ऑफ द विक्टिम कभी भी आपके पास विद इन एन आवर आते ही नहीं, तो आपको गैस्ट्रिक लवाज करने का मौका ही नहीं मिलता है. तो पहले हम लोग यूज करते थे, पहले हम लोग इवन 6 आवर्स तक भी अगर हमारे पास विक्टिम आता था तो हम KMNO4 यूज करते थे और उसमें लवाज करते थे. एक्टिवेटेड चारकोल भी हमने यूज किया हुआ है. बट मोस्टली अगर इफ यू हैव योर विक्टिम, योर पेशेंट इज अराइविंग मोर देन 2 आवर 3 आवर, तो एब्जॉर्प्शन तो ऑलरेडी हो चुका है, तो अब उसको जो है लवाज करने से कोई फायदा नहीं है. रादर यूज एंटीडोट्स. ठीक है. तो लाइक अगर ओपियोइड्स उसने लिया है तो आप नेलॉक्सोन दीजिए IV, और अगर उसने ऑर्गेनोफॉस्फेट खाया है तो आप उसको एट्रोपिन दीजिए इंजेक्टेबल फॉर्म में. दीज आर ऑल एंटीडोट्स. ठीक है. सो दिस इज ऑल अबाउट द गैस्ट्रिक लवाज टेक्निक. सो if
Sir,
you have
one question I'm having, sir. Sir, actually, what is regarding orogastric tube mentioned in toxicology books? Is it still relevant or not, sir?
yes, you can use orogastric, especially if you are suspecting that my patient is having a fracture in cribriform plate, or my patient is in DIC, that is a disseminated intravascular coagulation, or deranged PT-INR, or patient is having in dengue hemorrhagic shock syndrome. जहां भी आपको लग रहा है कोगुलोपैथी है और ब्लीड कर सकता है, वहां पे आप ओरोगैस्ट्रिक यूज करिए. इवन मोस्ट ऑफ द पेशेंट्स वी रिसीव फॉर द डेंगू शॉक सिंड्रोम, और हमको उनको एंटर फीडिंग शुरू करनी होती है, तो इनिशियली वी गो फॉर द ओरोगैस्ट्रिक ट्यूब्स, बिकॉज जैसे ही आप एनजी डालते हो पूरा ब्लीड करने लगता है विक्टिम, क्योंकि प्लेटलेट काउंट 8,000 10,000, तो ब्लीड करके ही पेशेंट को जो एस्पिरेशन न्यूमोनाइटिस हो जाएगा. उन कंडीशन में हम लोग ओरोगैस्ट्रिक ट्यूब डालते हैं, और जब धीरे धीरे उसका कोगुलोपैथी इंप्रूव करती है, INR इंप्रूव करता है, तो फिर हम शिफ्ट करते हैं नेजोगैस्ट्रिक पे. बट ओरोगैस्ट्रिक सिर्फ उन्हीं पेशेंट्स में, दोज हु आर अनकॉन्शियस. आप कॉन्शियस विक्टिम में ओरोगैस्ट्रिक नहीं डालेंगे, बिकॉज ही विल नॉट टॉलरेट.
Thank you, sir.
Any other queries? Okay. If not, I think that was a very fruitful session today, and all of us are well aware about the procedure of CPR by now. Let us pledge today that we will surely go back and first of all purchase such mannequins. One mannequins will cost not more than 20,000. Every institute should purchase it, and see teachers go back and see this video again and again. We have recorded it. We'll be sharing it very soon. So learn the procedure of CPR. You have many videos also available on the net. Read the contents available, and then try learning it for yourself, and then of course teach all the students regarding the procedure of the CPR, because every day we never know when this will be useful. Even as sir rightly said, even a layman should know the procedure.
Yes, absolutely. Layman and family members should know, because when you will need help, they will the only person
Persons
who
who
will
can
be
help us.
help us.
And post-COVID, the scenario is such that we never know whose
Yes,
turn
yes,
is when.
absolutely,
So
absolutely.
even small kids in schools, they have been
Yes.
taught with this procedure of CPR, and
We are training the
training,
school
yes, sir. Of course, school students also.
students in Institute of Science. We give in MMB, we
We
train
have
the,
trained. Yes.
because अगर गार्डन में मैं वॉक कर रहा हूँ तो यही लोग तो
तो
होंगे,
यही लोग तो
यही लोग
होंगे,
तो
सही
होंगे.
बात।
अबे रुइया ग्राउंड में वॉक करते
Walk
करते
करते
कुछ हो गया तो यही
सही
लोग
बात
होंगे
है,
पास
सही
में.
बात है. So we are all medico students, so we should know the procedure of CPR. And chats में एक बार, Dr. Ashish, could you see? Please check out for the chats if we have
वहाँ पे कुछ query होगी तो
questions.
yes.
Then, if it's just a note of thanks, then it's okay. So, on behalf of the entire fraternity of the Faculty of Ayurveda, not only at IMSBHU, but all the members who have attended the seminar today, we had 100 participation, the complete set today, and many teachers have exhibited this on their projectors to their college
Great, ma'am.
students. So thank you so much,
And
sir.
this is a very nice initiative from you, ma'am.
Surely,
This will help
surely, sir.
a country lot.
And people from South, East, and many regions have joined us today. And thank
Actually,
you so
NMC
much.
is emphasizing
There
so
is
much.
no question in chat box, ma'am. There is no question in chat box.
Okay, Dr. Ashish. So on behalf of the Agartantra Sambhasha, the whole fraternity of the Agartantra faculties, I wholeheartedly thank you, sir, for
Thank
your
you so much.
valuable,
Thank you,
as a
ma'am.
small token of love, this is for you, sir, from
Thank you
all,
so much, ma'am.
from all of us.
Thank you
I
so
thank all of you who have made it up today. I understand it's working hours for all of us, and in spite of your classes and your duties in your particular colleges, you have been here, and it's fine now, time to go home and have a cup of tea. And on behalf of all of us, once again, I wholeheartedly thank you, sir, and thank you all
Thank
of
you
you
so
for
much.
your
Thank
patience.
you.
Thank you.